From the Mayborn School of Journalism at the University of North Texas, this is NT Daily News.
Lawmakers in the House of Representatives passed two bills that would establish a path to citizenship to millions of undocumented immigrants. This comes amid a surge of migrants crossing the southern border, which doesn't appear to be slowing down. In the month of February, border agents detained a little over 97,000 migrants crossing the border. And this month alone, there have been over 11,000 unaccompanied migrant children detained by agents. Working during the pandemic is not something any of us could ever have anticipated. And for those of us lucky enough to have a job and work from home or work around other people practicing social distancing like we do here at the studio, we forget about that luxury. Here at the university, our police department has worked tirelessly around the clock since the pandemic reached American shores, continue to provide both security and aid to student, faculty, and staff.
We never closed. The police department never stopped operating. We just operated a little bit differently. As far as still responding to the calls, yeah, absolutely. We were still able to do that. I think early on, we definitely used some other tools that we had for some calls that necessarily didn't require a face-to-face meeting, right? But as far as our interaction with the community, that's never stopped. We just try to practice good social distancing and wearing face masks and doing the best you can. And I think the community's been real supportive of that. We've all helped each other out. And, I think it's been, making the best out of a bad situation.
In a document released by the National Urban League, Black Americans are 3 times more likely to get COVID-19 than white Americans. The report is based on data from Johns Hopkins University and comes as the COVID-19 vaccine became widely available to adults on March 29th. But there are some in the Black community that are hesitant in taking the vaccine, and rightfully so, considering the difficult history between the Black community and the medical community. Hundreds of years of medical experimentation and medical apartheid has cultivated not only hesitancy but distrust for the medical community among African Americans when taking the COVID vaccine. In 1932, the United States Public Health Service conducted the medical study of syphilis in Black men, known as the Tuskegee experiment. These men were never properly informed of the actual intent of the program. The fact that the medical community deceived these men and their families about the study, which lasted for 40 years, where 128 men died, is just one of many reasons the African American community frequently questions the motives and sincerity of the medical community.
The fact that we were excluded from a lot of those studies in the past in general, or when we were involved in ways that were completely disrespectful of our rights to informed consent and participation. As you, I'm sure know, everybody keeps referring to the Tuskegee Project with the studies on syphilis and the failure to treat, even though they knew penicillin was the appropriate treatment. Those studies, that history colors everything forward.
In the story of Henrietta Lacks, doctors from Johns Hopkins Hospital violated her rights, furthering not only hesitancy but distrust between the African American and the medical communities.
When you look at Henrietta Lacks, her vaginal tissue was taken in 1951. She didn't even have a right, she wasn't allowed to exercise her right to vote. I mean, there are a lot of things that have changed, and I think part of what we're going to have to do is help people understand that while that is our history, that is not our reality anymore. That there are concerted efforts in studies, especially for medicines, illnesses that are going to highly impact minorities, to recruit minority patients.
Whether enslaved in the past or free like African Americans are today, throughout history, Blacks have had minimal access to quality and affordable health care in the United States.
From the very beginning, we've always not had the best medical access from the beginning. From this in this country, our history goes even deeper than Tuskegee. I mean, the truth is, we were denied access to medical help.
But perhaps the solution to this problem lies in the past instead of in the present.
I think medicine has to get back to that field of small town doctor. When you have a doctor that's more in tune with what's going on with you, I think we start seeing that turnaround. So it really is the medical practice moving from the big business model through the small town doctor model to me, which is, we know now, the private practice model, and really treating your patients like you would want to treat your own mother. Because if I was a doctor and my mom is sick, I'm gonna make sure my mama good. Do that for me too, and do that for all your patients.
Matthew McConaughey, alongside the Just Keep Living Foundation, put on a star-studded virtual benefit to raise money for fellow Texans affected by last month's winter storm. The proceeds from the event, that can also be seen on McConaughey's YouTube page, will go to help rebuild parts of Texas that were hit hard by the winter storm and help Texans get back on their feet. The star actor made headlines recently when he was asked about running for the office of the governor and stated it's a strong possibility. Regardless of his politics, McConaughey's Weird Texas benefit raised over $130,000 from viewer donations and even more from other celebrities and sponsors from the Lone Star State in a night where it truly was about Texans helping Texans. The University of North Texas men's basketball team made school history, winning its first ever game in the NCAA tournament, upsetting the number 3 seeded Purdue Boilermakers 78-69. The Eagles advanced to square off against a tough 5th seeded Villanova, but unfortunately came up short, losing 84-61. But if this tournament is any indication, the rest of Conference USA will have their hands full with the program next season. For NT Daily News, I'm Joshua Carter.